important. So we are going to talk about drug addiction, and we have people from a lot of places. And let me just start my presentation. Can you see the presentation? Thumbs up if you see the presentation. So, okay, thank you. Thank you, Ruksar. Okay, today we are going to talk about drug addiction, and drug addiction is an important topic because a lot of time people are taking drug and they don't have the idea that they are getting into serious trouble, they are getting into serious problem, and what is the problem and what could be the side effect of that drugs. And we are going to talk about a lot of things, and we are going to talk about little bit about drugs and their types. Uh, Hands down. Thank you so much, Saman. Thank you so much, Ruksar. Please hand down. Okay. So let's see. Let's talk about drug and mental health, how drug is affecting your mental health, and also there are a lot of people who are consuming a lot of alcohol in due to certain reason, but it is affecting their mental health, and they are not even getting they are not even understanding the fact, because they're consuming and it gives them some kind of euphoria. They feel happy, they feel comfortable, they feel contented when they are taking that drug. But when the effect of that drug is gone, they are feeling again the same way that they used to feel before. So let's see that how it can affect. First thing, that it can it make you addicted in a way that you want to take that drug again and again. It means that you want to have same feeling of happiness, you want to have same kind of a euphoria. That's why they are consuming the drug. And the other thing that's affecting, that is giving a lot of people high blood pressure, and it could give them stroke. And it also affect the liver or pancreas. It also affect certain cancer, liver cancer, bowel cancer, and mouth cancer also. And also affect obtain the maintenance. Okay, it means that they are having issues in performing sexual activity. I'm talking especially about those who have children, and it's also having sorry, the married couple could have issues if a husband or wife is consuming drug and they're not able to conceive a baby. So sometimes that is also a reason why people are not able to conceive a baby. So what other good issues people could have or by taking that drugs is they can issue in difficulty in becoming pregnant, feeling like you must use that drug or alcohol more and more again, so until unless you become dependent, and you cannot live without that drug. And if a person is taking drug for a longer period of time, it could be any kind of drug, then it could make you feel sick, make you feel cold, sweaty. Thank you, Sama sir. It could give you withdrawal symptoms. That it means that if you're not able to take that drug, it is giving you nausea, panic like feeling, headaches if you don't take that drug anymore. And heart palpitation, like your heart is raising very high and you're not able to understand that what is happening with you. The other thing is that it is also affect your if somebody's facing mood changes, like rapid mood change, it could be a reason that the person is going through the withdrawal symptoms. Other thing is that what it could affect you is it could affect your okay, thank you everybody who just joined in, because I just started my presentation and I cannot read you. I cannot read I can agree, but I was just in between my presentation. Thank you so much, everybody who's from Gambia, who is from Mental Health Gambia community, and you all are doing great. And we also have a presentation tomorrow, but let's do this one. I'm also excited for that one. So when a person is consuming drug, it makes them negative as a whole person, and the person could lose motivation in life, lose motivation in going to office, going to school, going to universities. So I'm talking about these things also. Sometimes people think that that is happening because of person is having some kind of depression and anxiety, or he's is having some kind of a stressor. But this is not the case. Sometimes a person is a family member who is doing that might be consuming a drug. So if you see those people around you who are having that who have those kind of rapid changes, you can see that they're facing some kind of weight lose, weight gain, their skin is very pale, it look like their energy is drained. it might be indicated that person is consuming drug in your surrounding, and you need to take them to help. Okay. So next thing is, what other effect it could have be, it could give the person the feeling of depression, anxiety, problem with relationships. You know why people have problem with relationships when they're consuming drugs? Drugs are very expensive, and if a child or a person is all the time, I'm saying this because nowadays a lot of children are also consuming drugs, and they are becoming addicted, and they are becoming addicted because of so many reasons. And people just started that illegal business in the schools, in the universities, and just because of some money they are playing with the life of the children, they are playing with the life of the youth. And the youth is getting to that because they are searching for escape. They don't understand that, if they don't get this idea, that because they don't have that motivation, nobody's giving them that motivation, that if you're not feeling okay, if you're not feeling good, being sometimes you would see that that person would become cigarette. That is because the person is all the time in the urge to go to consume that drug. The person would steal money from the home, the person will fight with family, the person would fight with their sibling, with their parents, they will steal money, they will steal things, they will steal objects from the school, or from other people, so that they can sell that thing and they can eat something, or they can buy that drug for themselves. Other problem could be drug-induced psychosis, and that is a worse form of psychosis. Psychosis is sometimes when a person have lost the, you could say, reality contact from their life. So for that, and it is happening just because of if the person have taken that drug for longer time. And there are some form of drugs that drug as overall. So it means that somebody have taken drug that for so long, because drug is actually messing with your brain chemistry, it is messing with your whole body system, it is messing with you a lot of things. So if you see that somebody have that lost reality contact, means somebody would not know that what is happening around me, is it day or is it night. So it's like this person don't have reality contact. Or you would see that that person is wearing a sweater in wind in summer. So it means that this person is have lost the reality contact and he need immediate help. Okay. So I was just talking about psychosis, and it means that psychosis in psychosis it is processing like the world around you is different. People are different. A person would feel that people around me are trying to harm me. They are going to kill me. They are going to do bad things with me. So it is something like that. Osama, Uzair, your hand is up. Kindly, whatever you want to ask, please write down in the message. And we will also have a question answer session at the end, and there I can answer your questions. Okay? You just write down, or you could say that just note down your question. I will answer you later on. Okay. So in psychosis, it include how you experience and view things. Like I already told you that a person might feel that other people are trying to hurt me, they are plotting against me, they are going to poison somebody, they are going to poison me. Or a person might feel something or hear something that is not exactly over there. So it means that they have lose the contact, lose the they break the reality. And these are psychotic symptom, and it could be episode, it could be experience. Psychotic is basically the psychotic disorder, which we also call schizophrenia too. But it is because we call them a drug-induced psychosis. It is because a person is facing psychosis because of taking drugs, consuming drug or substance abuse. Okay. Now let's talk about different substance, different drugs, which could affect your mental health. Now let's talk about that. Okay, now let's talk about opiates. Opiates and other narcotics. It is basically kind of a narcotics that are powerful painkillers, and that could cause drowsiness, and that could cause intense feeling in the person, and it is directly affecting their well-being. Like the person might feel when they're taking that drug, or when they're taking opiates, they might feel excited, joy, and What are the form? What are the types? Let's talk about different types of opioids too. So you might have the idea that if a person is going through something, what those things could be. It include heroin. It include opium, codeine, uh, narcotics, pain, and medicine that may be prescribed by a doctor or bought illegally. And you might have some idea that a lot of psychiatric medication are not supposed to taken illegally until without a doctor prescription. And the reason is because those medication could be, or a lot of people are using them as a drug induced substance. They're using it as a drugs. That's why it's not advised to take them in a lot of without doctor prescription. Now let's talk about stimulants. And stimulant, we also have teas, like the stimulant affect it affect directly affect the nervous system and stimulate the brain. That include cocaine, that include amphetamine, such drugs that could also, those drugs are stimulant that is treated for ADHD. A different example as written over here, which is Ritalin, and a person can be needing higher amount of these drugs over time to feel same effect. That's why a person, I will discuss the drug cycle later on, that how a person is going to what is the cycle, that how a person went into using that drug, he's using that for experimentation, and then later on that converted into somehow their addiction. So uh, when there are a lot of other drugs type which could affect, or which is coming in the, people use that as substance abuse, are depressant that cause drowsiness and reduce anxiety. This is those drugs or those medication are advised to the patient so that they can affect their anxiety or depression. But what people do if they consume a lot, depression may also include alcohol, barbiturate, benzodiazepine, Valium, Etivon, Xanax, and there are other hydrate, and these are named by the way. But the point is that it these substance is used as drug, and it drug in sense of it could cause addiction. It could lead to addiction. And the other thing is LSD, mescaline, psilocybin, which are mushrooms, psychedelic mushrooms, and in a lot of countries, those drugs are legal now. For example, there was a news about a psychedelic mushroom that MDM and psychedelic mushroom are now legal in Australia, but they don't get this idea that a lot of people will have the access to takes those drugs now. What could that cause? It is also called PCP or angel dust that affect hallucination. I was just talking about people are thinking or they're hearing something that is not actually around them. Like they might be feeling that somebody is calling them, somebody is calling their name. It is because of hallucinations. It is called hallucination, and that might be the effect of the drugs a person is using too. And that is marijuana, cannabis, hashish. Um, now let's see. Now let's see that those substance use, why I'm talking about those things. When somebody came to us, like when somebody came to psychologists, then we have to take few things in our account, that either the person is having those symptoms, is it because of a person is taking some kind of medication, the person is on medication, the person on prescribed drugs, or the person is actually having those kind of, the person is actually having depression or anxiety just because of certain other circumstances in their life. But the substance use disorders, which could be, substance withdrawal, and they have dependency withdrawal symptoms. It is also affecting the body, that include nervous system, cardiovascular system. Those who are taking drug, that is the direct attack to their it is directly affecting their the the health of their heart, endocrine system, immune system, and heptic system. Okay, that is the reason. It is liver, by the way. And that is the reason who are taking a lot of drugs, they are direct, they are more prone to have hepatitis because of because drugs are affecting their liver directly. Next thing is that specific chronic and acute complication could be about with that person could be memory loss and overall cognitive issue. A person would not able to think clearly, he would not able to, you know solve his problem. He was not able to talk, he would not understand who he's talking to, he would have fight or different problems. and the person would forget everything. The person would forget where the car keys are. The person would fight over small things, and who would say somebody have taken those things, but it would be a memory loss. Other thing that is that a person could be affected with, or complication a person could have because of taking drugs. It changed the personality of the person. The person might be more aggressive than before. He might be more aggressive, more more talkative, or he might be just go to mute, and you might see that the person is overall changed now. His personality is changed. The other thing could be loss of nerve function. The person would get angry so easily. He would have stroke, seizure. So these are a lot of problems a person is going to get or going to have if the person is consuming the drug. काइंडली जब ज्वाइन करें अपना माइक वाला म्यूट कर लें बिकॉज we have discussed this thing also. Okay, there are the problems too, and I'm talking about the problems first because uh, just because of the thing that people use for for getting away with something, um, using that drug for for a party, because there are a lot of drugs that are called party drugs. People are using them in fun, but they don't get this idea that they are going to get addicted to those drugs, because there are few drugs that are very 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 addictive. And if you stop taking those drugs, then the person would feel substance withdrawal symptoms, and those are all the things that might be withdrawal symptoms, or that could lead to those problems that include heart failure, sexual depression, respiratory depression, anxiety, liver failure, cancer of different kind, liver, colon, blood-borne virus infection, and overdose, and it could lead to death eventually. So you need to be very careful. And if you see that somebody is around you or having those kind of things, you need to take them to the hospital. Now, let's talk about substances. What are those substances? What are the drugs that we are talking about for some time? The drugs could be prescription drugs. The drugs could be non-prescription drugs too. So let's see that what are those drugs. Screen nazar aapko nahi aa rahi? Can somebody see my screen? Please raise your hand if you can see my screen. Because I get a message that they cannot see the screen. Can somebody raise their hand or message me that they can see the screen? Yasmin, can you see the screen? Aapko screen nazar aa rahi hai? Yasmin, please raise your hand. Okay, thank you. Well, because I am doing that is online. It was just an issue. Okay, we have other participants. Okay, now let's talk about the drugs and the substances that we are talking about. It could be alcohol, cocaine, cannabis, hypnotics, sedative, hallucinogens, benzodiazepine, barbiturates. Other drugs might include inhalants such as pain thinners, aerosol sprays, gases, nitrates. People are using them as a no, actually the thing is that people are attracted to those things, and they're not getting the idea that why they are going toward that thing, why they're eating certain things, why they like certain sprays. People are doing that, and if people don't find one thing, and they go toward the other thing. So if you see that somebody in your home, if there's a child, if it's a family member, are doing those things, it might be because they're addicted to something and they're not able to get that drug, and that's why they're doing that. So it could be prescription, non-prescription drug. It could be codeine, heroin, and other prescription drug might be stimulant, adrenaline, like it's already mentioned that, and tobacco, nicotine, such as smoking cigarette, electronic cigarette, and there are a lot of people who are using cigar. So the point is, those are all the things, those are coming in drugs, and first the person start taking those drugs for, these are basically experimental drugs. People are taking this just for the fun, and people go to the party, and when they see one friend is taking that drug, then they start taking that drug, and they see, oh, and a lot of people are, or a lot of, you would say that user would say that to you when they're introducing that drug to you, that it is not going to happen, nothing is going to happen, and it's not going to affect you at all. But it is going to cost you a lot of things. So let's see if you can see that. Let's see what are the stages of drug addiction and how people are going to, how people become from using as an taking that as the drug as an experiment and as a regular user, then it is getting problem, and when they leave their drug, then it withdrawal symptoms came um, afterward. So the first thing is that there are several stages of drug addiction. First thing is experimental use, like I was talking about. You are in a party, you went to some friend house and they're smoking cigarette, they're smoking cigar, or they're using some other thing, and they ask you to use that, and they would say that nothing is going to happen with you. It is just, one time is going to cost you nothing. And there are new drugs in the market that are very very addictive. So you need to be very careful. If somebody is offering you, don't you should back off from that situation and do not take those drugs just because of experiment or just because of you want to feel included in that place. Do not take those drugs. Other thing is that when a person start doing that, um, first it is experiment. You went to somewhere, you that was a recreational thing, and then people start what they do. They start it could be, and when they use that drug, they might feel some kind of relaxation, some kind of a state in their brain. Then whenever something happened to them, something bad happened in their life, either it is depression, either it is anxiety, there's some conflict arises from their family, what they're going to do, they will eventually go to that drug because they want to have that feeling. It was some relaxed feeling, and then their senses is off. They are not, they cannot, they are off from the life, they are off from the everything, and they cannot think about those problems. First it was experimental use, now that would be a regular use, and people would start using that every time, and then conflict will arise, or they might start using it after eating something, or some specific time, or fighting with their parents. Either their parents are fighting and they're taking that drug. So from experimental use, it become a regular use. And what happened when it become a regular use? Because when a person start doing something, then there's a fixed time. After fixed time, that drug is not going to affect that person. Either, for example, if a person start from a small thing, either it could be cigarette, in the person would might start taking one small thing, one drug, and there are fixed point came when the drug is not affecting their body because they develop tolerance to that drug. Tolerance means your body is able to go to the other level. For example, tolerance, let me explain let me explain you with some other example. For example, one day you run for 10 minutes, other day you're going to run for 15 minutes. So slowly gradually your body is going to adapt that running, that physical activity, and you could do more physical activity, and your body would like to do more physical activity. So that is same is true for drugs too. In start it is for small period of time, and then it's a fixed time, then it's a regular use, and your body is immune to something, their body can take more. And you're not, when you're doing, your body is able to take that drug, your body won't, because the effect is not coming, your body is adapted to that drug, the effect, more effect is not coming. So what your body would want, your body would want a higher dose, a strong drug. That is how people get addicted to every drugs then. So from experimental use it become regular use, then it's a problem and risky. What does that mean? It means that the user lose any motivation, does not care about school work. Slowly the drug is taking over that person, the drug is taking over their nervous system, the drug is taking care over their cognitive system, and then slowly gradually person is going to lose motivation for everything. They want to be drugged all the time, they want to consume that drug all the time, don't want to talk to other people, they don't want to do anything. Because in real life you have to do a lot of things, there are responsibility, and people don't want to respond to those responsibilities sometimes, just because life is difficult. So for them it's an easy escape. So basically drug is escape for them, and people are taking drugs just because of escape. Now the other thing is that the risk is coming, and the person become more secretive, the person will not talk to you, your family member would get away from you, and they will become more secretive. They will have those friends who supply them drug, and they would steal for them, they will get into bad habits, other bad habits, and they will only talk to those people, those who are just like him. So he's going to get away from his other friend too. And when it turn to addiction, cannot face daily life without drugs, denies problem, physical condition, get weight loss, memory loss, overuse, become suicidal, financial problem, legal problems will get worse, because the person is taking all the time that drug, the person is not having any social relationship. The person is not going to school. The person is not going to job. If you don't have a job, then you don't have money to buy anything. If you don't have money to buy anything, then you could say your social circle is going to get minimized day by day, and you don't have money for survival. And if a person don't have money for survival, then he's going to get into bad habits of stealing things. So it is a whole circle. So a drug is going to affect your whole life. Okay, sometimes people say that other person is taking drug, it is not affecting them. So it is more like a likelihood of addiction liability, and it is depending on a lot of factors. So let's see what are those factors. आप में से किसी का mic on है, kindly turn off your mic please. Somebody mic is on and the voice is coming, and I have to check इसका mic on है. अपना mic off कर लिया करें. Kindly whenever you come in the presentation, please turn off your mic. I have to stop my presentation और फिर मुझे दोबारा के वो करना पड़ता है. Okay, so what is the likelihood of a person getting into addiction? How you take the substance? These are the factors that could determine or that could lead to certain things, lead to addiction, lead to withdrawal symptoms afterward. How you take that substance, such as orally, by injection, or by inhaling, and that is going to determine how that drug is going to affect you. The other thing is that the rate of which the substance cross the blood-brain barrier and trigger the reward pathway in your brain. That is the reason why a person is taking that drug, because drugs is activating the reward brain system in your body, in your brain. And when you are, and reward means that you're happy about something, you are feeling so high that you're a good person, you're the amazing person, and you like a kind of a euphoric state. You don't have any problems in your life. You're a king in your head. So its reward brain system is activated. It depends on the more a person brain have that reward system, the more he's going to get into that drug. The other thing is that the time it takes to feel the effect of that substance. If a substance is more effective in terms of giving you that feeling, then a person is going to toward that substance more. And the other thing is that the substance ability to induce tolerance and withdrawal symptoms. There are few drugs who have good tolerance. Saying good. These are not inducive, and few are very inducive. Few tolerance level get very slowly you reach to that level, but in some drugs they are very addictive, and you can cross that barrier so fast, and it would lead to directly, it would lead to problems in the form of the problems that we discussed already. So the other important thing is that the progress is complex, and several complex factors. What could be, people will say that everybody cannot be addicted, everybody cannot take the drugs. There are few people who are getting toward that drugs thing. There are certain reasons, there are certain things in your life that lead to that problems, and we are talking about social factors of why a person is going toward that going to consume the drug and going to get addicted to that drug. Because in the start, person don't have this idea how it is going to affect their life. They just want to get rid of that thing. They just want to escape from that certain situation, and they don't know that they did not have that, their body did not might have that idea that how it's going to affect them. So it includes contributing factor that includes substance effect on your brain chemistry. Every brain chemistry is not same, so it would affect some people and it would not affect some people, and some drug would affect you badly, and some drug might not affect you that way, but it's still addiction. But that drug might not react to some other body, so it's a different kind of a chemistry of your brain. Other thing is genetics. In some families, it is, there are some personality, you could say there's some like psychosis run in family, or there are some other disorders that also run in family, like diabetes or heart problem. Same is true for genetic might run in family too, because if a person have seen his father taking that drug, and his brain chemistry was so much according to that thing that he could follow easily into drug addiction habit, and he would have withdrawal symptoms so easily. So one factor might could be genetic too. Mental health condition, if a person is a family have a lot of problems, a lot of troubles, they have domestic violence in their family, they have other problems in their family, then they have more chances that people are going to use drug in that family. Access and exposure to the substance, that's very important too. I don't know you have this idea about Robert Downey Jr., which who played the very famous role of Iron Man. His father was a drug dealer, and his father would make him consume every drug, and he was drug addict. And before coming into that movie, he went to uh, treatment centers for years. Like many times he get inducted in those treatment centers. So it's how you have exposure to that drug. And adverse childhood experiences, and it could be different. Like I talked about some already, that it could be it could be domestic violence, it could be some other problems, childhood abuse, household dysfunction, witnessing domestic violence, or getting physically abused. It could be other form of abuse too, sexual abuse too, or emotional abuse too. Having family member with substance use disorder, people would see somebody and they would start consuming that also. And also parental problems too. Another thing that I talk about brain chemistry, let me define it a little bit more. Humans are biologically motivated to seek reward, and that is a natural ability, or you could say that is a natural, a basic need of a human body to have a reward system in their brain. So when these reward system come from healthy behaviors, when you spend time with a loved one or eat a delicious meal, then it is going to make you feel better. It is going to make you feel happy. But see, if a person is poor and he don't have those facilities in life, or if he sees somebody else in their surrounding who are more, who have more facilities in their life, then the person is going to feel bad about himself, and he would want to have escape from that thing. When a person is having a good meal and spend time with his loved one, then the body release a chemical called dopamine, which make you feel pleasure. It become a cycle. You seek out those pleasure experience. So every time you would take that drug, somebody is going to take that drug, and it is activating that reward system. And if that reward system is activated, then your senses are not working and you're feeling happy in that situation. So that's why people are taking that. And there are some disorders that are more prone, you could say, that to take medication, you could say, or take drugs or consume drugs. Attention deficit hyperactivity disorder mentioned over, and they're very impulsive people, and they have so many painful experiences, and they're in their impulse, they start they're more prone to doing that because they have a lot of troubles in their life. That's ADHD is mentioned out here. It could be bipolar disorder, borderline personality disorder, depression, generalizing anxiety disorder, and post-traumatic stress disorder. So if somebody have those problems in their life, then they might be more prone to getting into the cycle of drug addiction, drug abuse, or they would get addicted to that drug. Okay. So we talk about everything. Then let's talk about when to get help, because we talk about different drugs. We talk about what it is going to do with your body, with your brain, with your social life. Now let's talk about the symptoms that you have to check in yourself, or you could say check in people around you, your family member, your loved one, because there's a time limit came when your body just, your body don't get that, don't accept that, or cannot fight with that drug anymore, and it is going to, you could say that your body hands up over there. What could be the symptom that is affecting you? Confusion, neglect to eat, people don't want to eat. You might see them that they have very low body weight, like they're very 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 skinny, and sometimes they are even they are so weak, and even their oral motor area is so weak that they drool and they would sleep anywhere because they're all the time drowsy. And that's why if you take drugs, then they don't feel the urge to eat anything because they're so much higher over there. Withdrawal from friends and family, sudden changes in mood and behavior, engaging in risking behavior, that include driving, that include risky driving, that include one milling, that include driving in very places, you could say that dangerous places. And then hostility and denial when you confronted about abuse, drug substance use. So if you would ask those people, they're going to lie because it is how their whole system is built on the lie. So if somebody is consuming them and you ask them, then they will definitely deny that they're not consuming their drugs. And their behavior will be very secretive. Like I told you, that they would have those friends who consume those things, and those people would not be, you could say, it is also prevalent in the other kind of class too. Like I'm working with a girl, and she's in the university, and in the class in her university, even if it's not allowed in the university, then there are a lot of people who are using that. And if there's some event, then people are using them. And I'm talking about the high-fi class, or you could say the universities, and university where everybody is going, and people have this idea that is illegal, even then they are using it. You could say it's a fashion, or they want to get away from different things, whatever their reasons are. And using substance even when you're alone, like sometimes people are doing that because they're alone, nobody's around them, and they just want to get rid of that loneliness, because people say that depression don't kill them, sometimes loneliness kills them. So when you're alone, you have nobody around you, you have nobody around to talk, you have no one to share your problem with. So it could be a reason, it might be a reason that people are getting into um, substance addiction, you could say. And they could use anti, when I was talking about the types of those things, you could say that are additives, and those are the things that might be in your fridge, that might be in your in your household too. And that might be, people are using them might as a medication, like painkiller, people are also using them as taking that for those purposes. Need to be very careful. Okay, now let's talk about the treatment options. And there are main form of treatment that could be detoxification, means that the okay, those detoxification are happening in the hospitals. Over there, they take the inpatient, and then they completely stop the other drugs which a person was using, and then they try to counter that with other kind of medication. There is a cognitive behavior therapy, kind of a psychotherapy, and then there's a medication assistant therapy. It means that the person is detoxification because he's not taking that drug, and then he's using some medication who is going to help him out to feel better, or you could say that counter the withdrawal symptoms of that medication. Their liver could might be affected too, so they might be taking that medication. That's why it's written over here, medication assisted therapy. It might affect their kidney, so they might be taking some kind of purification medication. It might affect their heart, so they might be also taking some kind of medication that is for their heart problems. So the other form could be settings that could include outpatient, intensive outpatient treatment, inpatient treatment that I already told you about, and long-term therapeutic medication such as sober living. There's another problem too. When we talk about drug addiction problems, and when a person go, because we have a lot of institution in our country, and there are a lot of institution everywhere, and every year they would say that they might see that same person are coming toward those facilities, and they are same person and coming to facility, and they're not using drug for 3 months, and then they start using that for again. And what are the reason, what are the social factors why people are using those drugs? One of the factor could be people don't know other people than those friends who were their friend, who were giving them, supplying them medication or illegal drugs or things like that. So how you're going to change the person life of that person? He have to socialize, he have to find a job, he have to continue everything. So that is the reason why people have withdraw, or they just start using that drugs again. So that's for all for today. And anybody have any question? Let me see that. If nobody can ask, if people are shy to ask, say something or open their mic, you can ask me over there. Just type in the message. Let me see if somebody have any question. Samaza, thank you so much for coming. And okay, what is your business? Osama, whatever you write over here, it's your own choice, but it is going to affect the body, it is going to affect the liver. So if it is your business and you are using it daily, I cannot comment on that, because I'm not a medical doctor over here, but I give you the aspect of psychological problem, what is going to affect you, how it's going to affect your body. So at the end of it, that is personal own choice, what to do and what not to do. We can just warn them that it is how it's going to affect you. Okay, thank you so much, Muhammad Ali. Aapne thank you bola.
Hello, doctor. I have a question.
Yes, please ask the question.
Okay. Good afternoon, everyone. And my question is like, can someone with stress and cause mental disorder?
Mm-hmm.
Stress can that cause mental disorder?
Sorry,
And as a result of
repeat again.
can that lead to mental disorder? Stress.
Stress can cause mental disorder. What is your question?
My question is whether stress can, can cause mental disorder, stress. Like if you are in a very bad mood, and can that lead to mental disorder?
Stress can lead to mental health condition. I don't know you have attended our last session or not, but we have talked about that. There are
Okay.
certain things that we can say that that come in under that. We need to identify that either it's depression, either is it anxiety, or either it is stress. So we have to understand that what is the stress, and the other thing is that you also need to understand that, or you need to see that how that stress is affecting you, how the stress is affecting your body. And when we talk about stress, sometimes the stress is gone, but problem stays. For example, you have stress that you don't have a job, and you're stressed for that thing for some time. But when you find that job and you're still stressed, it means that it is some form of thing that you need to take care of. So did you get the idea what I'm trying to say over here?
Yeah. I can get you.
You
I'm
get
get
the idea.
understanding.
If you have any question, you can even ask me. But we discussed about this factor last time. That, and our old discussion was about depression, anxiety, but
Okay.
also included the form of stress, stressor, that how stressor are and how it is affecting you. So, somebody else have any question? Assalamu alaikum, Noah. Hope your mic is your. I will try to see that this time I don't open the few things that is not okay. Thank you. Somebody have any question? If you cannot ask openly, you can message me. I will respond to that if it is appropriate according to the situation or according to the topic.
Ma'am, I have a question. Assalamu alaikum.
Alaikum salam. Can you please say in the English?
Yes,
Because
ma'am.
it's for English population. Sorry, but
Okay.
for that, because
It's
the international.
okay.
Otherwise, if you cannot, you can write it down. Okay, I will respond to you. But you can ask the question. There is no complication for that. But आप उर्दू में पूछ, मैं response कर दूंगी, कोई मसला नहीं है.
Okay, ma'am. Hello, ma'am. Actually, my question is, I'm confusing in that how drugs can lead toward PTSD.
PTSD. It was,
yes, ma'am.
It was that because of PTSD you might take the drug. It was that point actually.
Means PTSD may
PTSD. Sorry, a person has PTSD, post-traumatic stress disorder, and he might start taking some drugs, and that lead to you could say addiction, that lead to withdrawal symptoms or whatever the problem is. But it's not that because of addiction who could have that. There could be some other thing too. Maybe if the person trauma is related to that thing, if a person have a trauma that that experience included some form of drugs, so in that way a person could have PTSD that included drug too, or that could be a trigger of that he's doing that. But it's not like that PTSD drug is you could say triggering PTSD. It's not like that.
Okay, ma'am.
For PTSD, you need to have something experience. Experience means experience in life. You might have seen something. It could be short, it could be long, it could be old. But if somebody, if a doctor prescribes somebody addiction because a person is not able to sleep at night, then because you might have some idea that those who have PTSD, they have night terror disorder too. They cannot sleep in the evening because they could remind them of something. It could remind them of traumatic experience. So if a doctor might give you some medication, and if a person start consuming those medication and using that for player purpose, or using them for because it might adopt to their system and they're not able to sleep, and he was taking one medication, then he started taking two pills, then 3 pills, then you can see that the addiction cycle started over here. You getting the idea?
Yes, ma'am. Yes, ma'am. Ma'am, it means you are saying that people who have anxiety disorder, borderline personality disorder, or something, bipolar, they are more prone toward drug addiction.
Remember that anybody could be prone to drug addiction. They could be prone to anxiety expression. Let me tell you something. There are a few factors that could determine that a person is going to have those problems in their life, which we call genetics, which we call environmental factors. Because if a person have somebody in their household who might be drug addicted, who might be schizophrenic, schizophrenia is something more have to do more with genetic part too. But if somebody is schizophrenic, then a person might adapt some symptoms from that person, some kind of personality pattern, some kind of thing to that person. But we cannot say that only those are the person who are prone to more those things. Other people could take any time of at any time in their life they could drug too. If suppose somebody is having domestic violence in their household, and if parents are separating and parent have god forbid divorce in their family, some kind of bad condition, then if a brain is if a child is dependent on their parents and he loves that parent and their parents are very protective, and somehow it affects everybody differently, that separation kind of thing, so he might start taking that uh, drugs too. If it are we have seen people that who have started taking drugs just because of experiment, like somebody else was doing that. And I have seen even a lot of people that husband was using drug, and wife just want to have one or two puff of that drug, and she get addicted to that drug too. So that's how, when we discussing about those things, it's how it's affecting a different perspective of their life. So we cannot say by saying that, or by saying that these people can have those problems, these people can have those problems, it would be a very complex answer to this question. Okay, so
Okay, ma'am. Thank you so much for your humble response. Thank you.
I'm sure I'm able to give you the idea that how it's affecting you. And anybody, why I'm saying this, the point is people think that, and that I would call is there are a lot of people in our society who think that, and this is worldwide too, that if it is your problem, then it is not their problem. So they're okay with that, but if they get that problem, then it means that is a problem. It means that is a world problem. So everybody have to talk about this. You're getting the idea? Your problem, my problem is everybody problem. So that is a general perspective.
Okay, ma'am. I get it.
Try to clarify that. Do not think that you're privileged, that you cannot get into those problems. You are not going to get idea that how this world is going to treat you, and this world is nobody's world. Anybody could have depression, anybody could get into depression, anybody could have anxieties in their life, and it could be PTSD, it could be anything. So try to be nicer, try to support those people who are in there, because you're not going to get this idea. Maybe if somebody born in your family and they have those problems, then you would say that society is not accepting that. When you are a member of society, you did not did something to, and you are in the power to do something. I'm talking about those people who are powerful, who to bring change. But until and unless they go to that problem, it is difficult for them to understand, and they need to develop empathy for the people. But you cannot drive people to will empathize with you.
Yes, ma'am.
So somebody else have any question?
Hello, doctor. I have a question again.
Yeah, please ask.
Okay, and my question is, and for example, like if a patient take wrong prescription of drugs from a doctor or from a health worker, and after taking that wrong prescription of drugs, can that cause any mental challenge or disorder in the person?
It could. Yes, it could happen that. When people are coming to us, why we are not medical professional, but we study those drugs, because when somebody comes to us, our first question is, are you taking any drugs? Are you on any prescription? Because there are withdrawal symptoms of that too, or there are some you could say effect of those drugs, like it could give you nausea, it could give you hyperventilation. So if you take that medication, you might see a leaflet in that medication, and everything is written on that. So over there you can find that what could be the possible side effect of that medication, or you might read that in over there too. So you can have those problems just because of that reason too. So that would be a yes, I could say that. Sometimes when it happened that they give you medication for something and it is not even working for that, because that might work for somebody. So if you are feeling that you're not able to get the desirable result from that medication, consult your doctor and ask him what you could do. Can he change your medication if the dose is not working properly? So the first response, if somebody asks me about medication, is I would say them to go to your doctor and talk to your doctor about those medication who prescribe you that, and ask him why he prescribed you those medication and what could be the side effect of those medication. And that would be more easy for you to respond, because when you go to that doctor, you might be going to that doctor for some time, and he know your history, and he might know that how that drug or that medication is responding to your body. So a safer way for you to be go to that doctor and ask that you are having those kind of a problems. Maybe the medication is not affecting, because there are a lot of medication. Even I think there's medication for epilepsy, or there are the psychiatric medication who who is going to give you skin problems, give you overweight, and so many things like dizziness, stomach problems. There are a lot of things. So but it would be better that it would be advisable to consult your same doctor, or you can take advice from some other person too, who is a medication who is a doctor too, but try to ask that person who give you medication.
Okay.
What's your answer?
Yeah, and the other question I have is can malnutrition cause any mental challenge or disorder? Malnutrition?
Sorry, antisocial.
Malnutrition.
Can you write it down?
Okay, let me.
Because we have different dialects, so I cannot understand what you are saying. It's not that you don't know what to how to pronounce, but we have different dialects, so I cannot. You could say I'm not able to understand what you are saying. Can you write it down in the message? Somebody else have any question?
Yes, I send it.
You write it down. Let me see if somebody asks any question on Facebook. Are you writing it?
Yes, I sent it already. I sent it.
Let me see if I get the question or not. Okay. Rukhsar, I'm giving you my number. I think you might have my number already. Do you have my number?
Yes, ma'am, I have.
Okay. Message me and I will add you in my group where I am, continuously updating. Sometimes,
can I message you direct?
Share that other.
Can I send a text message? Can I send a text message?
Sorry? Somebody's saying something.
Can I text you? Can I text you direct message so that you can add me to the group? To your group?
Yes. If somebody want me to be in my group, they can message me. Over there, I'm just sharing my things, my upcoming events, or somebody have any questions, so they can ask me and I will add them. No problem with that.
Thank you, ma'am, for this.
You're welcome. I think you're attending this for first time. Are you?
Pardon?
No, I'm talking to Rukhsar. Are you attending this for first time?
Yes, ma'am, I'm attending this lecture first time.
I'm doing this for some time. I don't know why. Nobody's fault. No issue with that. It's not even a fault. Why would we say that it's a fault? Everything is not a fault. Okay, I think he is writing. I cannot. Can you ask me that? Somebody else have any question? Then we have to close the meeting because I have to be somewhere else too. The participant who are not talking, they can write any question if they have. Otherwise, I'm going to close this meeting. And I will share the next meeting in the next session too. I will talk about that in my group.
Okay, ma'am.
You want to say something, Rosar? You can. Because I'm
So,
waiting
ma'am,
for the question to come.
I have one query and you just clear it.
Okay. Okay. I get a message, Usman. If I'm not, do you have my number? Because sometimes WhatsApp is not able to get those things. Let me give you my WhatsApp number. Let me type it down if somebody has some issue about they want to know about other meetings or webinars that I'm doing. They can have, or you can give a suggestion too. If you want any kind of session in your community, either it's your school, your organization, you can contact me for that too.
You can send your WhatsApp number.
I'm sending you my WhatsApp number. Okay, you got it. So thank you so much, everyone.
Can you send the code so that the country code before the.
It is. Somebody's came. Are you in any group, in a YEE group?
No, can you send the country code because it's 033? Is that the country
It is like that.
code?
If it is not working, then you try to add 92. 92 is my country code. Okay, we
92,
have attendee Kaval over here, and Kaval, do you know that we almost end our discussion, which is gone now.
You mean where what can I add 92?
No, you just try to do that. If it's not working.
This number, is it working?
Let me ask. Just give me a minute. I need to turn off every that recording because I think nobody have any question. So
I already text you my number. What's that number? Can you just
a minute?
send me a text on WhatsApp?
Kamal, do you have any
Text me
question?
on
Because
WhatsApp.
I'm going to turn off the recording.
Yeah. What I'm saying is you can send me a text on WhatsApp.
I
couldn't get you on WhatsApp.
Just a minute.
Yeah. Okay. I have no question.
Okay. So thank you so much, everyone who just joined us today, and see you in the next one.
Thank you so much, ma'am.